Hi, I just want to say thank you for your talk today, and that's coming from someone who disagrees with basically everything you say.
Oh, good. I'm glad.
But yeah,
thank you for coming.
So today you had a Twitter thread in response to Ted Lieu's comments on health insurance and the CBO report that
Yes.
came out about why pre-existing conditions should be charged more. For those with pre-existing conditions that become priced out of the market due to them being charged more, which I understand your reasoning behind, car insurance, stuff like that. I read the thread.
Well, I mean, to reiterate my point for people who don't understand, just so if you're coming in late to this conversation, Ted Lieu tweeted something out about how it's ridiculous, basically, for insurance companies to charge people with pre-existing conditions more. To which I said, it's an insurance company. Of course it does. I mean, every insurance company in history charges people more based on their risk profile. That's why you have risk assessors at insurance companies. So go ahead.
Yeah, and my question is, for the people who are priced out of the market
Yes.
due to that, is their only solution to go without health care? And why do you think that's an acceptable solution when most other nations have found a solution?
No, I don't think that's an acceptable solution. I think what we need to do is we've trained now 3 generations of Americans to be dependent on the government to fill that gap. So there are a couple of ways that you can tackle these issues. The chief problem, and I think we all acknowledge this, is that people don't buy. Let's say that everyone were age 0 for a second. Okay, everyone was born today. How do you solve the healthcare problem? You don't really have to solve the healthcare problem because people, presumably, you train them to buy insurance when they're young. The big problem is people don't buy insurance when they're young. Now they're 60, they don't have insurance, they have pre-existing conditions, and now no one's going to cover them, right? So we all know that the problem in the future is not going to be people who are 65 because in 50 years, 40 years, 30 years, they'll be dead, right? The big problem is going to be people who are 20 who are not getting health insurance now, and then in 40 years they have a pre-existing condition, they look for health insurance. So if we're talking about the future and the future plans for healthcare, what we need to be doing is encouraging young people to buy health insurance. Well, there are only 2 ways to do that. One is to use the government to force people to buy health insurance, and the other way is to basically have a market system that punishes people for not buying health insurance. Okay, the way you have a market system that punishes people for not buying health insurance is you make it very clear to people that there's a moral hazard involved here, that if you don't buy health insurance, that you're going to be paying more in the long run, so you'd better, pay health insurance right now and make smart decisions about it. Now, for the people who fall through the cracks, as I say, there's 2 groups now that we're talking about. There's people who are old and have pre-existing conditions, and it's too late for them. What do? They can't go back to being 20 and buy health insurance when they were healthy, right? So for those people, obviously, we have to have some sort of backup that phases out over time, right? That doesn't work the same way for a 60-year-old as it works for a 40-year-old or a 30-year-old who can buy when they're healthy, because we want to encourage those people to buy, not to be relying on government. And there I'm not against the idea of a phased-out government program based on age that helps subsidize people in pre-existing condition situations. And the other thing is that you have to have private charity pick up the slack for a lot of this stuff. And this is where I've said that I think that private charity does pick up the slack for a lot of things. I mean, Jimmy Kimmel made obviously a big to-do when he did a routine on his show in which he talked about how his baby son had been born. They took him to Children's Hospital. He had an open heart surgery. And that's why you need Obamacare. Okay, Jimmy Kimmel didn't have Obamacare. Jimmy Kimmel had private insurance. The fact is that private insurance, which covers the vast majority of the market, is still covering of pre-existing conditions because when you are employed and you have insurance, you're pooled with all the other employees of your company. That's the way it works, right? They don't charge you more with a pre-existing condition, at least in huge numbers, when you're getting it through your employer. So that's problem number 1 with Jimmy Kimmel is he already had health insurance. The problem number 2 that he didn't mention is that Children's Hospital is a charity hospital. A lot of people are coming in there with Medicaid, and the only way that people can get covered is not just through Medicaid, it's because there's a bunch of charity that's coming in and supplementing the Medicaid to pay the doctor. I know this because the doctor who operated on Jimmy Kimmel's son is a guy named Vaughn Starnes, and he operated on my daughter when she was 1.5 years old. So we were at the same hospital with the same doctor. The vast majority of patients there, I believe, were on Medicaid. And they were able to get care because of the charity that was involved. So my solutions are twofold. There's a long answer, but it's a complex question. So the answer is, 1, private charity needs to be increased so that we can help pick up the slack, because if that doesn't happen, conservatives, note to us, we need to give more charity because if we don't do it, the government's going to try to. Okay, and solution number 2 is that we have to have a phased-out program that takes care of the people for whom it's too late to actually make good decisions, but still encourages people to make good decisions now about buying their insurance, which means there must be a risk attached to not buying insurance.
One last just one ending comment. 2 things. First of all, if you're encouraging people to buy health insurance, at the age of 20 or an age like that, they're not going to have, the income or the percentage to donate as much to a better insurance plan, You
don't need a terrific insurance plan when you're 20. You need a catastrophic insurance plan when you're 20. And the truth is that most of the time you need a catastrophic insurance plan generally. You shouldn't have to go to an insurance company if you have a flu. You should be able to go to a doctor and pay cash.
And also, when you're 20, there are still people with pre-existing conditions that would jack up those costs, and getting it early might not help.
100%. But again, this is a time lapse question, because the fact is that my daughter was covered under my insurance, right? If you're under 20, you're covered on your parents' insurance typically. So, thank you.